recently I was at the American Hospital Association Leadership Summit in Nashville, and I was really privileged to meet with two different individuals who have great experience in board leadership for health systems. I spent time with Ed McKelvey, who is the chairman of the board for Roper St. Francis in Charleston, South Carolina. And then I met Sandy Smith, who represents the board for a major health system in Western Tennessee. And we started talking, and we were talking about access to care, which, as a leader within Conduit, is very, very important to me. But then we started talking about board representation and how board representation can really drive access, can really ensure that we are leading health systems in such a way that we are improving the care for the communities that are being served. I serve on the board of directors for Roper St. Francis Healthcare, so I'm fortunate to get to work with Ed every day. But I was so interested in hearing what Sandy had to say as a nurse. As I am a nurse, we're both nurses representing our practice on a health system board of directors, but then also thinking about who is on the board, who is representing all the populations being served. So not only bringing our clinical expertise, or could be financial expertise or educational expertise, depending on who your board has on it, but also really representing the various communities being served by the health system. And she really is passionate about this. And I was really excited to hear her views on that. And as I move forward in my healthcare career, and as I serve on the board, her thoughts around that are going to remain very close in my mind. How are we selecting board members, and are they representing the populations that we should be serving? So it was a great conference. I enjoyed being there, and I especially enjoyed thinking about board leadership and board representation for health systems.